Hello, this video is a small portion of a complete comprehensive video. If you'd like to see this complete comprehensive case and many other complete comprehensive cases, click on the link in the description below. So I'm reducing these teeth. Now, since this tooth was compromised, I'm doing something I often don't do here. I'm just showing you what I do. I'm not trying to pick perfect cases. I'm having the technician connect these two crowns to give the bicuspid tooth more stability. It's kind of the principle of broom straw. If you've got a broom straw by itself, you can break it easily, but if it's connected to a broom, it's stable. So in this case, I want to connect these two teeth, connect the crowns on these two teeth to give the bicuspid more stability. It's not mobile, but there's not a lot of bone on the distal of that tooth, and I don't want it to become mobile. What is that thing? An ounce of prevention is worth a pound of cure. That's why you want a treatment plan before you do these cases. That's the other reason why a comprehensive exam is critical if you're going to have this type of practice. So you have a plan, you go over it with the patient, you show them the photographs of your teeth, you show them these books or something like that. I show them PowerPoint cases so they can understand what they're looking at when they look at the photographs and radiographs of their teeth. If the patient doesn't understand it, if you think you're going to take a patient back into the operatory and examine them and say, you need this, 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 and this, and you're just telling them, that's going to go right over the top of their head and they're probably not going to do it because it doesn't make sense to them. Okay, so I'm prepping these teeth for crowns and they're going to be connected. Since this is not in the aesthetic zone, I'm not worried about taking these margins subgingival. I'll probably go to the gingival margin or maybe just a little above. It's easier to maintain. Just a lot of good reasons to keep crowns supragingival if you don't have to go subgingival. If they're not in the aesthetic zone, you don't have to prep them subgingival. So nobody's going to see this. I've got a crown on my own tooth here on my lower right first molar that is supragingival. One of my teaching faculty, Eddie Pruitt, did the crowns. We talked about it before we did it, and I said, I'd like that to be supragingival because it's not in the aesthetic zone. Easier to maintain, easier to impress. A lot of good reasons to keep it supragingival if you don't have to go subgingival. You know, lower anterior teeth are the same way. That's why you want diagnostic photograph. See what teeth are displayed when the patient smiles. Now I'm connecting these two crowns. Why? There wasn't a lot of bone on the distal of the second bicuspid. So I've had to, you can see this tooth was abscessed, so I've had to do endodontics on that tooth. Now this may be the first bite, we'll see in a minute, and that may be the cuspid. Anyway, I'm connecting those two with the crowns to stabilize the second bicuspid. Okay, so that is the cuspid and the second bicuspid are connected. I normally don't like to connect crowns to splint teeth because it's a little more difficult to floss between them. So the patient will have to use super floss and floss in between here, but it's a compromise. It's worth it because you're going to stabilize that second bicuspid tooth. Red rope wax on a cotton tip applicator, very simple. Isopropyl alcohol, dried off, carrier. So this is Vaseline we're placing in the interproximal area of the two crowns connected. Now we're going to seat the crowns. These are the two that are luted together, the cuspid and the bicuspid on the lower left. That's the dental minute. These techniques work and they work every time.
It's time. It is time to take your dentistry practice to the next level, and you know it. You just haven't known how to do it until right now. That's where dentistrymasterclasses.com steps in. At dentistrymasterclasses.com, Dr. Cutbirth is offering you his greatest work and his best cases. Here's everything that you're going to get when you subscribe to dentistrymasterclasses.com. Incredible comprehensive cases not seen in Dental Minute videos, an organized library of all the Dental Minute videos, and Dentistry Masterclasses comprehensive cases for study and reference. And you're going to get before and after photos of Dr. Cutbirth's fantastic restored work. So, great deal. $40, that is it. For $40, you're going to get all of this. So go right now to dentistrymasterclasses.com and subscribe today and change your life, change your practice.